patient, young, beautiful lady, just a star who suffers constant pain syndromes in the lumbar area in the right shoulder joint and in the right shoulder, and there is pain here, here, and here. But there is only pain when she's standing on the right leg, on the right foot. When she's on the left foot, everything is symmetric and the pain goes away. So it means there's instability in the right leg, but what does it have to do with the hip joint, with the knee joint, or with the foot? I place my patient on the chair and she's not very sure for this, for an athlete. So this is not stable, right? And I'm looking at the foot arch. I don't like it somehow. On the one side, the foot arch is big and give me a close-up. And on the other side, the foot arch is smaller. Then there's some pain here I want to know. And here, can you stand on one foot? I take the patient's foot, and I look at the level of the foot arch, whether there's some pain. Normally, nothing should change because you have palpated the foot. I'm palpating the other foot. Can you see that? And I can see how she feels. You said something. It's ouch. So it's not painful because you're not yelling. It's funny. Oh, ouch, ouch. I'm looking at the other leg, at the other foot. Is the reaction the same? No, everything is soft and nice and no problems and smooth. But as soon as I take the other foot, I see the muscle atrophy and there's a bone structure that protrudes and there's a sharp pain. What do you see? What do you think? The foot which has this load on the bone structure, what does it dream about? It dreams about alleviating the load, reducing the load. I want to check whether the foot is her priority. And I took the small foot step and I place it under the foot. I just place this foot step because I want this height of the foot to be slightly higher, slightly bigger. She is now standing on a more curved arch, and I want to know if something will change. I want this patient to check the hip bone and to check the pain. Oh, I can see no pain. I want to check whether I was mistaken. I remove this foot step from the foot and I load the foot and I see if something changes here. I cannot hear anything. Ouch. So we see pain. This means that the foot is to blame, but is the foot the culprit? Maybe the nerves are compressed, or maybe the nerves are compressed higher. I'm looking that maybe there's a compression of the fibular nerve, of the common fibular nerve at the level of the knee joint, because if you look at these slim and beautiful legs, which are a dream of any man and woman, this knee joint is slightly more even, and this knee joint has a slight internal rotation. Can you see that? This joint is very even, and this joint is not. This joint is even, and this joint is shifted slightly. I'm looking at the popliteal fossae, and I'm looking at them and the fossae, and turn round please. Each of you can palpate your popliteal fosses, and you can find one popliteal fossa and look at the other one. Ouch. You can see how even the foot is here. And as for this one, please stand straight. Do not move. There's a feeling that the leg is overextended here. The knees even here, and this knee is overextended. And what if you stand with the side towards us? Can you see that this is overextended? This knee is even, and this knee is kind of shifted towards the back, and there's a strong pain here. I want to know whether the problem is indeed with the knee joint. I tie this knee joint. I place a band over it. You can take a retainer, which will be much smaller, and I cannot make it somehow. Once again, please. Just the end. I want to have it under the knee. And this, just like this. Just like this. I have near the head of the tibia and the fibula, and I have pressed the bones to release the nerves, and I'm looking at the pain. How is the pain? And move the leg here towards me. How is the pain? There's no pain. This means that her problem is about the compressed nerve, which runs between these two bones, and this makes the foot unstable, and this overloads the lumbar area of the spine, lumbar spine, and it loads the shoulder joint and the fibular head. And this is how we look for the reason of a local problem. If I did not receive a reaction because I moved the two bones at the level of the ankle closer, I would be looking at the pelvis. I would then placing this belt on the pelvis like this, and here. If you immobilized the pelvis and your pain went away, no matter where it is, this is a problem that starts at the pelvic region. I'm looking at the pelvis. Nothing helps. This hip bone used to be higher and it remains high. How is your knee? Her pelvic area is okay. I want women to hear me who have ever given birth. If you have ever given birth, do not forget that the rehabilitation after the delivery is the most important thing you have to do. No matter where you feel pain, try to mobilize your pelvis with a belt. And if the pain goes away wherever it is, it's the sign of a pelvis instability as a consequence of the bone deformity of the sacrum and the pelvis. And this means that if you immobilize your pelvis and the pain goes away, no matter where it is, the problem is with the pelvis. If you immobilize the knee joint and the pain goes away, the problem is in the knee joint. If it goes away, if you raise the foot arch, the problem has to do with the foot arch. So no gymnastics will help. If you open the internet, I found more than 300 types of gymnastics. Which kind of gymnastics will help my patient if her head of the fibula is not stable? Her nerve is compressed. How can you work? How can you load various areas and get an effect? There will be no effect, and gymnastics are there, but they give no effect, not because they're bad, but because they do not have an individual approach. They are developed without an individual approach. For this patient, before she starts doing gymnastics, she needs to restore the fibular head and remove the compression of the nerve to stabilize the foot in order to place it in an optimal way and then to load it with the gymnastics. Dear friends, it's your big moment now. It's your joy of life now. You have found the opportunity to hear your body. This is not a difficult methodology. It's simple and it's easily accessible to each of you. You can find your pain. Just check what changes with your pain when you change your position, and then you will find the reason. If it's the whole limb, then immobilize your pelvis and the knee and raise your foot arch, and you will find the reason. And my patient has the problems that have to be with the pectoralis minor, and she has cervicobrachial syndrome, and she has problems with her lumbar spine. If she came to a classical neurologist, she would get 3 diagnoses: lombodynia, cervicobrachial syndrome, and the pectoralis minor syndrome. Each syndrome will be treated separately, and there will be muscle relaxants that will be prescribed and special gymnastics for each joint, and each area will be rubbed violently with anything but just to create the appearance of a treatment. And my patient has a problem in the knee joint that does not manifest itself in any way, and that's why, in order to help our patient, we will very quickly fix this nerve, and we will fix this, we will adjust this nerve, and we will restore this mod.